Hello, my name is Sydney Webb. I have done my practicum project on congenital syphilis with the Medical Institute for Sexual Health in Dallas, Texas. I am part of the Master of Public Health program at Liberty University, and my concentration has been community health promotions. If you go to the next slide, you'll see that the purpose of this practicum project was to address the congenital syphilis crisis in the United States. So to understand the purpose of this practicum, we have to begin by first examining the effect that syphilis has on newborn babies. Congenital syphilis is a sexually transmitted infection that is passed from pregnant mothers to newborns during pregnancy or delivery. Congenital syphilis in newborn babies can cause miscarriage, stillbirth, premature birth, low birth weight, and even newborn death. For infants that do survive, the newborns are often plagued with deformed bones, anemia, enlarged spleen and liver, jaundice, brain and nerve problems, blindness, deafness, meningitis, severe skin rashes, just really terrible afflictions for these newborn babies to go through. And with all of that being said, on the next slide, you'll see that there is a congenital syphilis crisis in the United States. This crisis highlights the need for improved risk avoidance measures, such as patient education, early and effective STI testing and treatment, and adequate prenatal care. In the last decade, we have seen a dramatic increase in the number of congenital syphilis cases in our country. They've increased tenfold. In 2022, over 3,700 babies were born with a syphilis infection. Of those 3,700 babies, 231 were born stillborn and 51 died as infants. On the next slide, you'll see this figure from the Center for Disease Control and Prevention, also known as the CDC. This is a really great visual that shows us the super steep incline of the surge of cases over the last 10 years for congenital syphilis. Again, this is really important because congenital syphilis is a completely preventable infection. It is treatable by just penicillin G. If we were able to identify mothers early in pregnancy, screen them, and then adequately treat them, we would be able to reduce this rate of infections in newborns. So if you turn to the next slide, the design of my practicum project started by looking at the competencies for the Master of Public Health program. So the foundational competencies that I referenced in my project was number 9, design a population-based policy, program, project, or intervention. My project was targeted at the vulnerable population of pregnant mothers and newborn babies. Number 19, communicate audience-appropriate public health content, both in writing and through oral presentation. I've done that when I presented my practicum project at the NSR Coalition, and I've also generated audience-appropriate public health content in the form of patient education materials. Number 20, describing the importance of cultural competence in communicating public health content. I really took into consideration the way that I was communicating and talking about this topic, because when you talk about medical things, sometimes it can get a bit confusing. So I really wanted to make sure that I was being language appropriate. The concentration competencies that I referenced for the Community Health Promotions Program were MH1, use best practices to assess health needs, assets, and resources for poor, underserved, or vulnerable populations, and MH6, apply the Christian worldview to public health practice in diverse settings and populations. During my practicum project, we really focused on risk avoidance. Safe sex is no longer a term that is often used, and so the term risk avoidance has been pushed in the Christian community more. And really, risk avoidance is exactly what it says, avoiding the things, avoiding sexual contact outside of marriage that could lead you to these type of infections. On the next page, I go into the design of the practicum. I created 2 deliverables. They were patient education materials. One was a trifold brochure and the other an informational guide. I also listed my SMART objectives here. This is how I based the effectiveness of my deliverables. So number one, by the end of the practicum, give a presentation on congenital syphilis with education tools to increase patient information and awareness, as measured by 75% of participants being able to describe 2 effective prevention measures for congenital syphilis. My second SMART objective had to be modified due to some unforeseen circumstances, but it did work out in the end. By the end of the practicum, in combination with the Medical Institute for Sexual Health, the student will publish educational tools online as measured by 75% of presentation participants having access to the tools via QR code. By the end of the practicum, in combination with the Medical Institute for Sexual Health, begin publication of educational tools as PDF versions as measured by 75% of presentation participants having access to tools online via PDF. I will say that that last SMART objective was not met at the time that we defined these SMART objectives. It was not known that the Medical Institute does not publish their patient education materials online, and they also do not have a social media, which is why the second objective had to be modified. So it did work out in the end. I believe that the patient deliverables were effective, and creating a QR code that is easy enough to just be scanned and you're taken directly to those deliverables is going to be easier access for patients in the long run anyway. On the next slide, you'll see the methods for my practicum project. So participants were asked to identify 2 effective prevention measures for congenital syphilis. They were given a short 3-question survey. The first question was multiple choice, as was the second. It just asked them to state an effective way to prevent congenital syphilis. And the third asked if they were able to reach the patient deliverables online via the QR code. So you can see from the graphs that are on this methods page, 16 out of 20 participants, which is 80%, identified 1 correct effective prevention measure. And then you can see on the second graph that 15 out of 20, or 75% of participants, identified a second effective prevention measure. Which did ensure the effectiveness of our patient education materials. On the next slide, you'll see the accomplishments for this practicum project. 2 out of 3 of our objectives were met. That is something that I'm really proud of because I wasn't entirely sure if I was going to meet even 2 of them. One did have to be modified, but I believe that modifying it was very public health related because things don't always go as we plan. And I think it's important to be able to move fluidly with the direction that your project is going in and know that sometimes, you do have to change things. And that's definitely a lesson that I did learn during this experience. It's also a challenge that I did not anticipate. I didn't know that MI did not have social media and that they don't post their education materials online. After I delivered my deliverables at the NSR Coalition, they actually came back to me and said that they are now going to start publishing their education materials online under a student publishing page. So I'm anxious to see my work on their website as soon as that is up and ready. I don't know if I would have done anything differently because I am very proud of all of the accomplishments and the data that we did get back from this presentation. The deliverables received positive feedback from the participants of the presentation. Most of the people on that board have higher education in public health related fields. And so it was really nice to hear that everything was displayed nicely. The language was just right for the audience we were trying to reach. And so I did appreciate their feedback in that way. It also instilled a newfound confidence in me in creating patient education materials and presenting it. I was very nervous that my materials were not going to go over well. and that I was not going to be able to eloquently state what I was trying to say during the presentation. But again, the feedback that I received was very positive, and so that reassured me and gave me a newfound confidence in myself. On the next slide, you'll see the recommendations that were made for this project. I recommended to the Medical Institute for Sexual Health that they broaden their distribution of patient education materials, and it seems that they're now doing that, so I'm happy to see that. I recommended that they create social media accounts and also hire a social media specialist. If you are trying to get into the world of sexually transmitted infections, the population that has the most amount of sexually transmitted infections is between the ages of 15 to 24. Those are also the most active users of social media. And so reaching those populations is definitely going to be effective if you have those social media accounts. The Center for Disease Control and Prevention to reduce the rate of congenital syphilis in the United States recommends screening all pregnant women and their sexual partners for syphilis during the initial prenatal appointment and then continue throughout pregnancy. They recommend that you identify any healthcare encounters for pregnant women as opportunities to screen and treat syphilis during pregnancy. A lot of times women are not receiving adequate prenatal care, but they are being seen in other healthcare situations such as emergency department visits, syringe service programs, maternal and child health programs, and even jail health visits. So there are other opportunities for us to meet these mothers and test and then adequately treat them. I want to say thank you to all of my professors at Liberty University for helping me along the way. Thank you to Dr. Graff for advising me this last semester in my practicum. Thank you to the Medical Institute for Sexual Health in allowing me to complete my practicum there. And lastly, thank you to my family for putting up with me for the last year and a half and for pushing me through. So thank you.